Healthcare in general is moving to more outpatient management, and that means for us trying to keep our patients at home and out of the hospital and out of the emergency department. The care model that we follow, especially with remote patient monitoring, is to keep the patient at home, and so we're focusing on quality of life, lowering and minimizing distress, and that also includes minimizing trips to the office.
Current Health was really helpful in a reduction in our readmission rate. Our goal is essentially to help them keep out of the hospital, help them stay in their home, help their caregivers to figure out what to look for with them. We actually have gotten to one of the best readmission rates in the country. We're at 6%.
Heart failure and the treatment of it, it really depends on a lot of vital signs like heart rate and blood pressure. We actually use those numbers to make changes to medicines, whether that's adding or decreasing or discontinuing. And so the data is really important for us because normally if you're just using a clinic appointment, you've got one set of data, which I don't know what that patient does when they're at home, what they normally eat. So the benefit of the remote patient monitoring is I know what their heart rate is while they're in their home setting. I know what it does when they're moving around, when they're sleeping, and that makes a big difference on making medicine changes.
The Current Health product has been really instrumental in us being able to titrate those medicines up quickly. A lot of the medicines that we use for heart failure can lower a patient's blood pressure and lower their heart rate, and those two in particular are something that with the Current Health technology we can monitor at home. So instead of a patient coming into clinic every 1 to 2 weeks and giving us some blood pressure readings that they may forget to bring in, we can accurately know what's going on at home and if we can safely titrate the medicine up.
One of my patients, like 2 days after she went home, the alarm went off and they called and said her oxygen saturations have dropped really low. Checked in on her, sent her back to the hospital. She ended up in the ICU for a couple of days, but did well. We really think that it saved her life.
If we're seeing a new patient or a hospital follow-up, nearly every single one of those patients gets the Current Health system. And we have found it to be really, really useful in keeping them out of the hospital, figuring out how to get them into the clinic faster if we need to.
The movement to more patient care at home has the chance to sort of revolutionize the care that we deliver. Changing of care models, lower costs, and then patient satisfaction. That's going to allow us to do more and more things from home in a safe, high quality, effective way. Why would we not be excited about that?